They said, "Are you serious? You really are coming? And we're not stealing you away from Frank Judson." I said, "No, my life is changing. I'm coming." And so they had me come in and talk to them, and the next thing I knew, they were creating a position. They did not have any nurses in STD at CDC at the time. They knew of what we had done in Denver, and they said, "Would you be the STD nurse consultant? Go around the country. Your job would be 25% travel. You got to go to different clinics. You got to help them turn things around." And I said, "Sure." And I asked my parents to keep the kids for a month.
Where in Virginia were your parents?
Little town called South Hill, Virginia.
South Hill? Oh my goodness.
You're familiar with
I
South
do
Hill?
know it, yes.
Okay, yeah.
It was on my route to Chapel Hill.
Oh, okay. It's right on, it's an exit right on I-85, South Hill, Virginia. They have 40 acres, and my brother and I still have 40 acres. They had 50, but after my dad died and then my mom decided to leave, she sold the house in the 10 acres around the house, but the other 40 acres are for my brother and I to someday do something with. But that's where my kids spent a lot of summers. They call it Camp Nanny and Pop Pop, because that's one of the reasons why I chose UNC in Chapel Hill, because it was only 90 miles from where my parents were. Mm-hmm. And with young children, I knew I was going to need that family support. Mm-hmm. So even though the University of Washington with King Holmes was one of the places that CDC would have preferred me to go, I just changed divisions in CDC so that I could get the support I needed to go where I wanted to go. And I knew that UNC was a great school. Bill Jenkins had been there. So that's where I wanted to go. But so I came to CDC. Creating positions in the government, there's always a freeze, and so it was a temporary, not to exceed 1 year position. So I took it, and I got involved with helping the resettlement of the Cuban refugees back in 1980. Many of the men came into the country with positive VDRLs, and they didn't know if they had latent syphilis that needed to be treated or if they had been exposed to other tropical diseases, and so the best judgment was to give everybody treatment before they were resettled. So they had to get 3 weeks worth of bicillin. There were 1,000 men in Fort Indiantown Gap that this applied to, and they did not have the nursing staff to do that because the nurses didn't want to give the bicillin unless there was a physician there. And I knew that the likelihood of anaphylaxis from bicillin was nil. We had been giving bicillin all the time in the clinics, and so we needed to get these people rapidly treated. So I went out to Fort Indiantown Gap, gave my kids
to where?
Fort Indiantown Gap, Pennsylvania.
Okay. And
that's one of the resettlement camps that they had. All these Cubans in barracks. And so I went out there to give shots. Just launched shot after shot after shot. Gave my kids, they were ages 2 and 4 at the time. Gave them to a neighbor because I didn't know people. I had a neighbor who said she would keep them for me, and I went up for 3 weeks. And as a result of that, a permanent position became available at CDC. In the meantime, a nurse at CDC, a civil servant position, had taken me under her wing and said, "You need to apply to get into the commissioned corps. You're a registered nurse. You can come into the nurse corps. You've got the degrees, and you need to get your application in, get your transcripts in, do your physical." It was a lot of things to do. And so I had started doing that. But the position became available, and I was advised that I could wait until the corps position was available or take this one before the freeze became a freeze again. So I took that position, civil servant position, GS position, for 6 months. And then I was able to convert over to the Corps, which was a good thing. But I converted in January of 1981, and Reagan had just been elected in 80, and he closed the public health service hospitals 6 weeks after I became commissioned, which meant that the public health service physicians and nurses with seniority were bumping down their ranks, and now I had 6 weeks of seniority in the nursing Corps, and there were maybe 3 public health service nurses at CDC at the time. It was likely, but they had more seniority, it was likely I was going to get bumped. At the same time, I learned that EIS was a protected category, because EIS officers were all new, and they were a cadre of specifically trained individuals who were exempt from bumping. So I applied to EIS. At that time, you did not have to have a doctorate. At the time, just a master's degree. And I was able to get into EIS and became one of the first EIS officers in the division of VD control. And my first outbreak was a pretty large outbreak of chancroid in Southern California in 1981. And to date, it is still the largest outbreak of culture-confirmed Haemophilus ducrei. We had 266 men and 5 very active women, obviously prostitutes.
Do you remember the other African Americans who were in the EIS?
At that time, there were others ahead of me. I think Diane was in the year ahead of me. I think she was
Diane Rowley?
Diane Rowley. I think she was in 1980. Marshall and Jurgen Alsop and Walter Williams came in with me in 81.
Mm-hmm.
But I had been at CDC for a year and a half before I started EIS.
Mm-hmm.
I don't remember the names of others who've come after
Okay.
me.
No, that's okay, but I just meant, because Bill Jenkins was in EIS, wasn't, or not in EIS. He was in
Bill
CDC.
Jenkins came into CDC in 1980, I believe.
Actually, he first came in, oh, I'm sorry, yes, you go ahead. He entered the Commissioned Corps in 1967, I think, and he went to CDC for his physical exam, and they turned him away. But he didn't get into CDC until later. You're right.
Yeah. I didn't think he had been a commissioned officer for some reason, but I thought he came into CDC about the same time I did. I think I preceded him, but I think he came in, because I remember when I first met him, I think he came in the fall of 80, but he'd been in the government before.
Well, when did you meet Bill? Do you remember that?
Probably as soon as he came in 80, because we were in the same division.
Mm-hmm. Okay.
I was in the training section, and he would have been in the statistics section because he was a math statistician.
Mm-hmm.
And so we became friends right away. While I was at an EIS, because this disease was so rare, I got a lot of support from different people. Dr. Mary Guinan was wonderful, helping me with my first MMWR and encouraging me to submit abstracts to present papers at national and international conferences. I presented at the International Society for Sexually Transmitted Disease Research. I think it was in Vancouver, whatever year that I presented. But with all the support I got, I became, really, really interested in epidemiology, and I realized I found a niche. I knew about epi. Frank had helped me understand, because we were doing epidemiologic treatment of patients to prevent syphilis. But I didn't realize the whole range of epi until I got the training in EIS. And at that time, MDs could come in. I'm not even sure they had to have an MPH. We had a lot of training the first 3 weeks of the program. And I remember Dr. Virgil Peavy, who's since passed on. He did remarkable courses with us. Of course, we didn't have computers. They gave us handheld calculators, and that was it. I mean, we did odds ratios on the calculator. That's all. No such thing as logistic regression or anything in EIS at that time. That was back in the dark ages. So with this basic training, I knew I wanted more. And someone told me about the long-term training program at CDC, that I could go ahead and get a PhD if I got supported. And that's when I started looking around and decided I wanted to go to UNC, and saw how long the program was and thought, okay, I'm still, I'm a single parent, I've got to raise kids. So Emory began an MPH program in the early 80s, and I started taking MPH classes from Emory, and was encouraged to go ahead and matriculate to get an MPH, but I was doing it just to make life easier when I got my PhD. So that was a good thing. So I got the MPH from Emory in 87, and I applied to UNC also in 87 and started in 88 in the EPI program, and got the long-term training, which allowed me to have 2 years away from CDC to devote just to school, to getting the coursework out of the way. And then I came back to Atlanta, and as I tell people, I commuted to Chapel Hill while I was doing my dissertation. I had another colleague that I met out there when she got her MPH. She came back to Atlanta with me, and she was going to live in Macon while she looked for a job in Atlanta. And I had an extra room in my house, and I said, "No, Martha, come and stay with me while you look for a job." And we thought it was going to take her just maybe 2 months to get settled, and she wound up staying with me a year. And it was wonderful because I could leave for a week and go back to Chapel Hill, and she was there with my young teenage kids, and so it worked out for both of us.
So, any special professors that you remember?
Well, you, of course, for my very first introduction to EPI, and it was EPI 160, I believe.
168.
168. I remember Joyce Allen, who was the Student Services Manager. And I'll tell you, she did try to talk me out of taking that course because I had a master's in nursing and a master's from Emory in EPI. And she says, "You don't need that." And I said, "Yes, I do." I could have.
You could have exempted. You could have exempted
it and gone right into 268. But no, I wanted everything that
I'll have to
everybody.
speak to Joyce about that. I'm glad you didn't listen to her.
No, I thought, no, it's been a long time since I'd been in school on a full-time basis, and I just wanted, and I was older. I was an older student. I mean, I was 38 then, and and the other students were in their 20s, and so I'm always doing things later than everybody else seems like. But
I took epidemiology several times.
Yeah. So.
Any other faculty come to mind?
Oh, well, of course, Dr. David Savitz, he was my chair. Dr. Siobhan Harlow, she's not there anymore, but she started out as a chair.
As your dissertation
She started
chair?
out as my dissertation chair, and then when she left, I switched to David. Dr. Dorothy Brown, she's no longer there, but she was in the MCH program.
Yeah, I've worked with Dr.
Yeah. Oh, Milt Kotelchuk, Dr. Milt Kotelchuk.
Yes.
We're still friends. We had dinner just the other night.
Would you give him my regards? I haven't seen him in a long time. He used to be a neighbor of mine as well.
And I met him when I came to UNC because I wanted to be in the EPI program, but MCH was my love, so I had to get to know the MCH people. I missed David Kleinbaum by a year because the year I started, I think was the year he went to Australia.
So who was teaching 268? Was it David Savitz? Or David
Savitz, I believe, but there were some graduate students who were teaching it with David Kleinbaum's notes. So I got David Kleinbaum's course, all of his notes, everything from David Kleinbaum, given through somebody else.
I vaguely remember that.
Remember that?
Interval. Yeah.
So we're talking 25, 30 years ago. So
that's okay. I don't know we didn't talk about that beforehand, but I just thought of it as you were telling.
Yeah. So when I finished my 2 years of residency in '90, I came back to the division, to CDC, went into the Division of Reproductive Health. I knew, and I started working with Diane Rowley on the topic that we were interested in, which was the racial difference in preterm delivery. At that time, the rate was something like, the risk for preterm delivery was like 18%, I should say the risk, 18% of African American women, and at the back, 1988, 1990, and half that for white women. Now, the rates have gone down over the years for everybody, but we were done by that. Diane had published some work, or was working on some work at the time, on the racial difference in infant mortality, and she published a paper in the American Journal of Epidemiology on the college-educated women, where she, I'm blocking the name of the person that she, you can see his face, that also is on that paper. But at any rate, looking at college graduates, married white women, college graduated, married African American women. And there was still a twofold difference.
Mm-hmm.
Even though the rates were down for everybody, there was still a twofold difference. So we were trying to figure out what it was and decided we needed to look at African American women and stop comparing them to other populations, but to look within the population, because our control group needed to be more like the population of the cases that we were actually interested in. And so we began to look at preterm delivery and the stress of just being Black in America. We had a conference where we were going to look at that, the stress. We suspected that racism, institutional racism, we could not get permission to have a conference using the R word, and so we had to change the title to the stress of being Black in America, or something like that, but we could not use the word racism anywhere at that time when we were trying to do this research. And
this was the late 80s.
This was early 1990. This was early 90s.
Early 90s.
This was early 90s. And it was in that environment, this American College of Epidemiology had a conference in Atlanta in 91. I can't remember the title, but...
The morbidity, mortality gap, is it race or racism? Race or
racism, that's it. And it was out of that conference that Bill Jenkins and others gathered to other African American researchers to say we really need to look at this, and the Society for Analysis of African American Public Health Issues, still don't know that word, was formed. Bill was the founder. I became the first treasurer. We were collecting like $10 dues per year. Just to have enough money to publish a newsletter and mail it to people to pay for the postage and that. So I became the first treasurer. I was on the board of our credit union, so I think that's why they decided that I was worthy to be the treasurer. And I remained treasurer for 25 years. I just gave that role up last year. SAAPHI is a very thriving organization now. So proud of the young people who have taken it on. Its website is www.saaphi.org.
Good.
Okay.
Good.
So I stayed with DRH for until 2008. Fast forward, I did get my PhD in '92. And then...
That's very impressive, by the way, that you had 2 years in residence and then you worked on your dissertation completely remotely.
Yeah.
And you finished in just a few years.
Yeah, 4 years.
A fair number of our students, once they leave, it just never happens. It's very hard.
See, I'm driven. And I would go back once a week, every 6 weeks. I couldn't do it at home. I set up my little dissertation room. I had the book, How to Write a Dissertation and Succeed, or Survive Writing a Dissertation. I can't remember. It was a great book. And I had my little dissertation space, but I also had kids.
Yes, and a job.
I had a job. And I remember on Saturday mornings, I would go into work because I could work on my computer. I tried the first month. I would go into work and bring my TV. I had a little TV, a couple of blankets, and some bowls of cereal, and take my kids in and plop them in front of the cartoons so that I could work, because I didn't have a computer at home. So I could work on my computer.
You didn't have a computer at home?
No, not at first.
Wow.
And then they could watch TV and eat cereal while I was, right. And so.
But this wasn't the late 80s, was it?
This was 1990. 1990.
Oh my goodness.
This was 1990.
May I ask why you didn't have a computer by 1990? Just out of curiosity. I'm trying to remember how many people had computers then, but I thought they
I
were.
didn't buy my first computer until way after I got married in '94. I think we bought our first computer in '95.
Really?
Because we were real excited about it. I mean, we weren't on email back then.
Yeah, I
There
guess.
was no email. And I
Well, there was
remember
email in the
spending about
mid-'80s. There was email
yeah,
in the
but
mid-'80s.
I remember spending about $3,000 buying that first computer.
Yeah, they were expensive.
Yeah,
They
that's
were
why I didn't have a
expensive.
computer.
They were expensive.
I was a single parent. I had children.
Oh, right. Okay.
I couldn't
Yeah.
afford a computer. So I had to.
Even with the CDC salary.
No. Computers, thousands of dollars.
Yes, no, I appreciate it.
Yeah, no. My master's in nursing, I typed on an electric typewriter at the clinic, at the Denver Metro Health Clinic. That I would go after hours.
But that was the early 80s, right?
That was in the 70s.
In the 70s, yeah. No,
In the
people,
70s.
there wasn't an alternative in those days.
Right. In the 80s, getting my MPH at Emory, I could use my work computer to work on my thesis. But working on a dissertation, as you know,
Yeah.
you need a computer.
Right. Oh, no, of course. I got my first computer